Hello, this is Dr. David Greene, CEO of the Arizona Pain Network, where we bring you anything and everything educational for pain management. Today the topic is avoiding surgery for degenerative disc disease. The normal intervertebral disc is composed of 80% water and 20% collagens and protein. The best analogy that I can use is that it's similar to a jelly donut. You have the outer part of the donut that's called the annulus fibrosus, and then the gelatinous inner part, which is the jelly, and that's the nucleus pulposus. This has some nerve endings and it can feel pain, the outer part. The inner part has no nerve endings at all and can't feel anything. It normally acts as a great shock absorber. When we walk, bend, twist, flex, water comes out of the disc to absorb shock and then comes back in. Well, with degenerative disc disease, and this affects millions of Americans, the discs start to lose water content. So no longer do you have this 80% water and this healthy plump disc, but more like what you see here in the cartoon, where you start to lose water, and it's similar to a flat tire, where you start to get some bulges, and you can get some tears and cracks in the outer part, remember the annulus, which has some nerve endings, and pain. 40% of the time, when someone has low back pain, it's coming from a disc problem. It may also not just cause back pain, but may also have some inflammation sparked up and irritate these adjacent nerve roots. So it may also cause leg pain as well. That's called sciatica. Now, just because you see degenerative disc disease on an MRI, and for instance, here you have a healthy disc, see how it's white? That's water. So that's healthy, and that's degenerative. Okay, you have some bulging back here. Just seeing this doesn't mean the person's going to have pain. In fact, 35% of individuals between the ages of 20 and 50 have degenerative disc disease on an MRI and have no back pain whatsoever. Or it may lead to disabling pain, inability to work. The treatment options that are non-operative, first is just over-the-counter pain medications, such as Tylenol, anti-inflammatories. They may work very well, especially for mild to moderate back pain. Narcotics are good for acute exacerbations of pain. They're not a great long-term solution. The risks start to outweigh the benefits. You can get tolerance, addiction, constipation. Topical medications such as lidocaine patches, capsaicin creams, anti-inflammatory creams, those can be great because they don't get systemic and they act locally and they have virtually no side effects. Muscle relaxers are also good for times when a person has significant spasms and aching. So once again, short term, just like narcotics. Physical therapy can be very helpful. It can help strengthen the muscles around the spine to help take pressure off of a degenerative disc. Also the modalities such as electrical stimulation, ultrasound can also be great. Chiropractic treatment involves manipulations which can be helpful, TENS units, and there's also an overlap with physical therapy where you have the electrical stimulation, the ultrasound. What you see here is a spinal decompression therapy table. It involves intermittent spinal traction that's computerized, and it creates a negative pressure in the disc spaces and helps pull in oxygen and blood supply to help repair a degenerative disc. Another treatment that's been shown in multiple studies to help with degenerative disc disease is acupuncture. When you move to more interventional treatment options, trigger point injections involve tiny little needles that are placed into the muscles of the back, and this can help a lot with spasms and aching. Here you see an intradiscal injection, and that's been shown in multiple studies if you use cortisone to provide potentially months at a time of pain relief. It's not going to fix a degenerative disc, but it can help a lot. Also, there's a lot of research going on now looking at either platelet-rich plasma therapy into the disc or stem cells with either bone marrow-derived, fat-derived, or amniotic-derived stem cells. And those are showing a lot of promise, but there are no large-scale studies yet. What you can also have is abnormal motion due to the degeneration here, which can lead to increased stresses on the facet joints in the back of the spine, and this can cause facet-related pain. So what can be very helpful is medial branch blocks, and I'll show you a picture in a second to explain that, or facet injections. Radiofrequency ablation is another procedure that can be very helpful and provide 12 to 18 months of consistent pain relief. Epidural injections can be helpful. You might say, why would you put an injection in the epidural space if it's a disc problem? Well, as I mentioned, the inflammation from the tears in the outer part of the disc can inflame some nerve roots and cause sciatica. So the epidural injections can be very helpful. IDET is rarely performed now because insurance companies won't pay for it. Some research studies came out showing that it was not very helpful. So it's not really getting reimbursed. MILD stands for minimally invasive lumbar discectomy, which is more for herniated disc, but for degenerative disc, some pain doctors will do it to help decompress and offer pain relief. So here's a picture that shows the medial branches, these tiny little nerve endings that supply sensation to these facet joints. So you have them on both sides. Now, if they're a source of pain, and along with the disc, what you can do is inject some numbing medicine around these and stop the transmission of pain, and that's called a medial branch block. If that works and wears off, you can either repeat it or move on to this, which is a radiofrequency ablation, which is the application of thermal energy and heat to these areas on both sides, and that can deaden those nerve endings and provide pain relief, as I mentioned, for 12 to 18 months. Very impressive. So what's the overall outcomes? Well, a recent study in the World Neurosurgery showed a comparison of long-term outcomes for patients with back pain who had a discogram, and basically it didn't show any difference between outcomes of pain, health status, satisfaction, or disability, and whether the patients had non-operative treatment or a spinal fusion. So there's a lot to say for non-operative options. You don't have the risks involved. You don't have hardware put in place. So 3/4 of the time, patients are able to achieve a satisfactory level of baseline pain when they have degenerative disc disease and are able to avoid surgery. Arizona Pain Specialists has the top pain clinics in Arizona. There are 5 locations offering comprehensive pain management, all the treatments that were discussed here at several locations, taking over 50 insurance plans. The pain doctors are board certified. They've won the Patient's Choice Award 5 years in a row. The number to call for scheduling is 602-507-6550. Or visit us on the web at ArizonaPainNetwork.com. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.